Medical school trains infectious disease specialists in complex pathology, not the daily mechanics of revenue cycle management. Yet, practice owners quickly find that billing is exactly where their operations break down. Look at the front desk of almost any independent practice today. You will see administrative staff attempting to sort through complex rejected claims while simultaneously juggling patient intake and phone calls. The sheer volume of paperwork creates an overwhelming physical and mental burden. This chart tracks initial claim denial rates across the healthcare industry. According to data from Kodiak Solutions, that rate has steadily climbed, reaching 11.81% in 2024. In practice, that means roughly 1 in every 7 claims you submit comes back rejected the first time. Payers are systematically issuing more medical necessity challenges and requests for information, requiring your team to review, correct, and resubmit an ever-growing stack of files.
When insurance providers aggressively challenge claims at this volume, billing ceases to be a standard administrative task. It becomes a bottleneck that starves the practice of the cash flow required to survive. While denied claims create a massive problem on the back end, practices are losing even more time at the front end before a patient ever begins treatment. This diagram illustrates the weekly time cost of prior authorizations. A 2024 American Medical Association survey found that the average practice completes 39 of these requests per physician, consuming 13 hours of staff time every single week. The administrative load is so heavy that 40% of physicians report having to hire staff members whose sole responsibility is negotiating with insurance companies to get these authorizations approved. This continuous friction takes a heavy toll on the staff. In that same AMA survey, 94% of physicians identified the prior authorization process as a major driver of their professional burnout. The delay also causes a severe failure in clinical care. Because the approval process is so protracted, 80% of physicians say it leads patients to abandon their recommended medical treatments entirely. These industry-wide challenges hit infectious disease practices particularly hard. The ICD-10 diagnosis codes for viral, bacterial, and parasitic conditions are highly specific, requiring precise documentation and exact modifiers. Furthermore, payer coverage policies for complex treatments like long-term antibiotic regimens, antiretroviral therapies, and hepatitis C protocols shift frequently. What one insurance plan covers smoothly today, another might block tomorrow. Managing this complexity requires experienced personnel, but the MGMA reports a 33.3% annual turnover rate for business operations and billing staff. This chart outlines the financial impact. Beyond the baseline salary of $55,000 to $75,000 for an in-house biller, a practice spends an additional $9,000 to $12,000 every time they have to replace someone. The exact replacement cost is only a fraction of the total loss. While the seat sits empty, and while the new hire spends months learning the specialty-specific codes, unworked claims pile up and revenue permanently slips through the cracks. This dynamic creates a staffing spiral. Practice owners end up paying premium operational costs for continuously shrinking collections. Industry data indicates that practices improve their resolution rates not by hiring more general billers, but by utilizing dedicated, specialty-trained resources who thoroughly understand their specific payer mix. To make an outsourced team effective, they must use direct EMR integration. This mock-up shows a secure digital bridge connecting a remote billing server directly to a clinic's local interface. Rather than relying on manual file exports or insecure screen sharing, the remote team works natively inside your existing software, whether that is Epic, Athena, or eClinicalWorks. Operating natively eliminates workflow lag and prevents data translation errors. Once integrated, the team maintains an updated library of payer-specific protocol documentation. By tracking exact coverage rules for complex infectious disease treatments, they can verify documentation and catch coding errors before the claim is ever submitted. Direct EMR integration effectively turns billing from a reactive chore managed by a rotating cast of employees into a proactive, unified system. Staffingly provides a methodical sequence for infectious disease practices to implement this system and exit the turnover spiral in exactly 14 days. Step 1 focuses on technical setup. Within the first 48 hours, Staffingly maps your workflows in a kickoff call and establishes the native EMR connection so their team can work inside your system securely. Step 2 moves to execution.
The dedicated billing resources conduct targeted team training on your practice's exact payer mix and then begin processing claims during a 14-day go-live pilot. Step 3 establishes long-term visibility. You receive weekly KPI reporting to track first-pass resolution rates, allowing the team to execute monthly workflow refinements that continuously optimize your revenue cycle. Behind the scenes, the team utilizes AI smart routing. This technology evaluates claim types based on payer and code complexity, automatically assigning them to the right specialist so backlogs never form during high-volume periods. By combining this AI-augmented workflow with a highly structured onboarding sequence, practices can confidently transition their billing without losing control over their cash flow. Control and trust begin with proper credentialing. Every specialist on the Staffingly dedicated billing team holds active AAPC and AIMA certifications. They operate within an enterprise-grade compliance infrastructure. This includes SOC 2 Type 2, ISO 27001, HIPAA, and HITRUS certifications, ensuring that all patient data remains strictly protected. For practice owners who have survived payer audits, this level of rigorous compliance delivers immediate peace of mind. You have a certified, focused professional securely handling your revenue cycle without the distraction of front desk operations. The financial advantage of this model is clear. Staffingly provides these dedicated teams starting at $399 per week, which is a fraction of the fully loaded cost of an in-house hire. This chart compares the results. While the healthcare industry struggles with an 11.81% average denial rate, Staffingly's dedicated approach maintains an error rate below 1% across their base of over 800 practices. To evaluate this system for your own practice, visit the Staffingly website. You can claim the 30-day free trial and utilize the 14-day pilot to test the integration with zero long-term commitment. Outsourcing to an integrated, specialized team permanently stops revenue leakage. It removes the administrative friction from your front office, allowing your infectious disease practice to focus entirely on patient care.